Estrogen cream. Let's talk about that for a second.
Yeah. So this is like a buzzy thing right now. I think that number one, people are talking about perimenopausal state a lot more, which is great. Estrogen and HRT, hormone replacement therapy, is still considered a little alternative. Not that it's bad, but we are noticing that it's a lot safer now. There was a really bad, there was a study that came out a while ago that said it increases your risk for breast cancer, which it can in certain people. And that's why you have to really, really be careful and screen and make sure you don't have those risks. But guess what? Like perimenopause also can contribute to is like cardiovascular disease and things like that. So when it comes down to topical, there's two main types. There's estradiol, which that's the vaginal cream, or that's the cream people use that actually goes in systemically. That's a little bit stronger and can affect your like systemic estrogen levels. And then there's estriol. Estriol is more like, let's help find lines. Let's help with like how the skin looks. And I think it really depends on your goals. Are you going in wanting like more estrogen because you have other symptoms? Or are you going in wanting like more skin hydration and things like that? Again, I don't think like estrogen cream is going to like replace all these other skincare items. But I think if you are low on your estrogen, if you truly are in that like menopausal or postmenopausal state, I think that we're learning so much more about it. And I think most derms are team yes. But you know what does increase fat? Sculptra. So everyone says it stimulates collagen, but like if you think about it, I do like non-surgical BBLs or, what we know about Sculptra, and I know some plastic surgeons are like, don't do Sculptra, it's going to mess up your facelift. But any great plastic surgeon is going to look beyond that. And that's why you need to do these energy-based devices. You should be able to do so. It will be really weird if you went straight to a facelift without doing anything. So get your Sculptra, get your injectables. Obviously, there's a balance to it. Get your energy-based devices. That's okay if it's going to make your facelift a little bit more difficult. I notice it when I'm doing submental lipo. If some patient went in and they did cool sculpting, if they went and did Kybella, if they went and did radiofrequency microneedling, that my cannula, which I'm supposed to suck fat out, is supposed to like glide like butter. It is hard. There is scar tissue there. There is inflammation there. That's like tightening the skin and what your body's reacting to. So is that a bad thing? No, it makes my job a lot harder, and it could potentially result in a poor outcome for patient, but they'll still get a good outcome. And then it may potentially lead to like more bruising and inflammation because I'm going in there like jamming this cannula in there when it's really supposed to glide really nicely. So that's just all I'm saying with a lot of these things. Don't be so scared to do them because they could potentially make other things in the future harder. Yeah.
Got it. Okay. Let's do some derm approved or not approved.
Ooh, I love it.
Some rapid fire. You can do like one sentence to explain.
Love.
Snail mucin.
Oh, snail mucin? Yes.
Yes. Approved?
Okay.
One sentence.
Snail mucin is a yes. I don't think it's the end all be all, but I think that there's some merit to some of the like benefits, and I think it's fine.
Threads.
Threads, love-hate relationship, but I would say mostly no, and I do offer them, but it's a no for most of my patients. Eye cream is a must. You must use an eye cream for your eyes and not just your skin care for your face, for your eyes. Spironolactone is definitely a yes. I think that it does wonders for hormonal acne, although there are some alternatives such as Derm that we can get into.
Yeah.
Okay.
You can tell us real quick.
Yeah.
We can open it up for that one.
Derm, I'm not saying is like completely comparable to, and Derm is like a supplement from like cruciferous vegetables. And I find it for my patients who don't want to be on spironolactone, or we're just trying to find an end date, because that's the toughest part with my Spiro patients. I'm like, when do we get off of it? And oftentimes I will like wean them off, or they're on like 50 instead of 100 or 25, which is like not even therapeutic dose. But DIM is really interesting because I have this whole protocol that we can talk about at some point on supplements, because I love supplements. And I think it's a good like introductory way to treat some of this hormonal acne. Or Nutrafol Women's Balance has some things in there to really balance that estrogen and testosterone without changing your hormones. So that's a good pick. DIM is a good pick, which has like very similar ingredients in there. So I say try that out first. And then if it doesn't work, see your derm for Spiro.
Amazing. Easy gel.
I love Easy Gel. We talked about that. I think it's great. It doesn't add volume, but I think it's great for skin quality.
Kind of interesting. Self tanner. People were worried about glycation.
Oh, interesting. I think you should worry about glycation for like eating smoked foods and all that, like the ages, smoked foods, all of that. So I think self tanning is like great. Yeah.
It's non-professional grade skincare.
Non-professional grade
Like
skincare.
Sephora.
Yeah. I think that there are great skincare ingredients out there. Like it doesn't need to have studies on it. I think that be really careful about what you're buying that's like super crazy on TikTok Shop or on Amazon, because that's where we get into a lot of issues. But I think Sephora really vets their products.
Tretinoin,
so that's the prescription strength. I don't think everyone can tolerate it. I myself can't tolerate it. There's things like Altreno, which is prescription strength. But I think that if you can use a retinol every day, the effects can be very similar.
like over the counter.
Yeah, retinol is like way less of a strength than prescription strength retinoid.
What do you like? Do you like Alpha Ret?
Alpha Ret's good. I think Revision has a really great one. Rock has a great introductory one. So yeah, there's so many brands. Can be drugstore or whatever.
Sunscreen.
Sunscreen a must. If you're at all worried about sunscreen in general, use a physical sunscreen such as mineral or titanium based, or such as zinc or titanium based. I think that if anything, wearing a hat, protecting your like body when you're out hiking or doing something is like really important.
Face taping.
Well, after talking to you, I love that you use it for a specific reason. That's correct. So if you done correctly, I'm pro, Derm approved.
I have to say, I have this girl who listens to my Patreon. I've had a few of these who said, I'm 38. Someone said I'm 40. I've never had Botox. I was thinking about doing it, and I did the face tape instead, and it looks like I have Botox. So I'm like,
good for her.
Amazing.
Yeah, whatever. Like,
Ashley, have you tried it? Oh.
Yeah, I think that if it works, fine.
Yeah.
Like, I'm not going to like bash things, you know? If it works for someone and, you know, it's not doing harm, go for it.
I think like, and I'm not affiliated in any way, and I'm not like benefiting off of these rolls of tape in any way. But I think if people are on the fence for whatever reason, or if somebody's like pregnant or they have autoimmune issues and they're not sure, or they just like don't want to be injecting something, or they can't afford it. There's so many things that, you know, constraints that people have where they can't get like traditional neurotoxins. It's like, why not try it? It's $20, you know, for like a whole roll, and you might be surprised.
Exactly.
Yeah.
As long as it's not damaging the skin or anything like that, I think I'm all for it.
Yeah. Amazing.